Hello, Dr. Butt.
Yeah, good morning again.
Oh, good morning, Dr. Butt. Thank you for joining us here on CommerceConnections.tv. Dr. Butt, can you please give a brief summary of your bio and your career summary for the listening audience?
Yeah, I'm a family physician and board certified, and I work at Access Community Health Network, which is the largest collection of federally qualified health care center in the nation. We have 51 clinics. I'm the deputy medical officer of Access Community Health Network, and I also serve as attending to Mount Sinai Family Practice Residency Training Program, as well as I participate in longitudinal educational program for Rush University and University of Illinois Medical College.
That's a very impressive medical history, Dr. Butt. Dr. Butt, we're going to be talking about the Alzheimer's disease today, and basically we're going to ask you a few questions. Well, not a few questions, but it'll be a lot of questions. but we want to be very informative to all listeners. So therefore, let's start the first question with, when was the disease first discovered?
Alzheimer disease, which is a brain disorder, it is named after a German physician, Alois Alzheimer, who described it in 1906 for the first time. So that goes back to 1906.
I see. And so what would be the medical definition of Alzheimer's disease?
Yeah, Alzheimer's disease is the most common type of dementia, accounting for 50 to 70% of the cases. And dementia you can describe in general terms for loss of memory and other mental abilities severe enough to interfere with daily life, and it is caused by physical changes in the brain.
I see. And so now these physical changes that are caused in the brain, are they due to plaques?
Absolutely. There are two abnormal structures, so they are called plaques and tangles, which are the reason which is believed to be damaging and killing nerve cells. Plaques and tangles were among the first abnormalities which were discovered by Dr. Alzheimer when he saw his patient who was a female in 1906, and now it has plaques and tangles. The name is different from what described. And it is plaques build up between nerve cells, and they contain deposits of protein fragment called beta amyloid, and tangles are twisted fibers of another kind of protein called tau, and tangles are inside dying cells. So most people have some plaques and tangles as they age, but this is quite different. Plaques and tangles tend to have a predictable pattern in Alzheimer's disease, where they begin in the areas of important areas of learning and memory, and then spreading to other regions.
I see. So now, how do we understand the early onset of the disease? What do we need to know?
Yeah, the thing is that Alzheimer's can, it doesn't have a common pattern of symptoms, but there are ways that we should have early warning signs, because it starts with some very benign sort of symptoms. We have to look out for them, and that's why it's so critical that warning signs can be just starting from some very common lapses of memory. For example, forgetting, say, names and things which are so very commonly, that we know, like say for recent names of people, names of individuals who you come in contact, or somehow forgetting where you put the key or the wallet. So it starts with very, very simple warning signs.
I see. And so what is the age range probably for early onset of the disease?
Yeah, it's, like Alzheimer's usually should be after 65, but there are cases where you may have genetic predisposition where that may start early on, and that is like before 65 years of age. Usually we do find a genetic component to that.
So you're seeing a lot of the Alzheimer's disease in your seniors?
Yes, it is more prevalent in seniors, especially after 85, but it doesn't mean that's the age we should look for that disease. It is, like after 65, yes, one should start looking out for those patients who may be susceptible to Alzheimer's. It's important for a primary care physician or family physician to look out and screen patients for Alzheimer's disease.
I see. Now, Dr. Butt, let's discuss the stages of Alzheimer's disease. How many stages are there?
There are 7 stages of Alzheimer's disease, from stage 1 to stage 7. Stage 1 is no impairment, which is normal function. Unimpaired individuals experience no memory problems, and none are evident to healthcare professionals during an interview. Stage 2 is very mild cognitive decline, maybe normal age-related change or earliest signs of Alzheimer's disease, where individuals may feel as if they have memory lapses, especially in forgetting familiar words or names or the location of the keys, eyeglasses, or other everyday objects. But these problems are not evident during a medical examination or apparent to friends or family.
I see.
Stage 3 is when there's early stage Alzheimer's can be diagnosed in some but not all individuals with these symptoms. Friends, family, or co-workers begin to notice deficiencies, problems with memory or concentration, may be measurable in clinical testing or using detailed medical interview. Common difficulties include word or name finding problems noticeable to family or close associates, decreased ability to remember names when introduced to new people, performance issues in social or work settings, which can be noticeable to family or friends, reading a passage and retaining the material, losing or misplacing a valuable object, decline ability to plan or organize. Stage 4 is moderate cognitive decline, mild or early stage of Alzheimer's disease. At this stage, a careful medical interview detects deficiencies in the following areas: decreased knowledge of recent occasions or current events, impaired ability to perform challenging mental arithmetics, for example, to count backwards from, say, 85 by 7, decreased capacity to perform complex tasks, such as planning dinner for guests, paying bills, or finances, reduced memory or personal history. The affected individual may seem subdued, withdrawn socially, or mentally socially or mentally challenging situation. Stage 5 is moderately severe cognitive decline, which is moderate or mild stage Alzheimer's disease. Major gaps in memories and deficits in cognitive function. Some assistance with day-to-day activities becomes
a problem. I see.
Unable during a medical interview to recall any important details as the current address, their telephone number, or the name of the college or high school from which they graduated. And stage 6 is severe cognitive decline, where moderately severe or mild stage Alzheimer's disease. Memory difficulties continue to worsen. Significant personality changes may emerge and affect individuals in a way that extensive help with daily customary activities is required. They lose most awareness of recent experience and events and also they cannot recollect their personal history, and they also generally cannot recall their own name, and they start experiencing significant problems with going to toilet, say for example.
I
They
see.
have disruption of sleep,